Welcome to the 2021-2022 Simcoe County Homeless Enumeration Point-in-Time Count. The Simcoe County Alliance to End Homelessness, in partnership with the County of Simcoe, is conducting the 2021-22 Simcoe County Point-in-Time Count, PIT count, from January 25th to the 27th. This activity will serve the purpose of counting and understanding the situation of people who are experiencing homelessness in Simcoe County. Our goal is to end homelessness in Simcoe County. What is a point-in-time PIT count? Point-in-time count is done during a 24-hour period to provide an estimate snapshot of the extent of homelessness in Simcoe County on a given night. It will gather information on both the number of persons, families experiencing homelessness, as well as their demographic characteristics and service needs. The methodology of a PIT count has been used in many communities across Canada, making it possible to compare results across the country. Surveys take place across Simcoe County during the night of Wednesday, January 25th, and will be strategically scheduled during time frames that enable accurate counts, such as evenings where people are more likely to have settled down where they are planning to spend the night, in a shelter or possibly on the street. There are many benefits to a PIT count. The PIT count allows us to count people and help measure the needs for shelters and services in Simcoe County. The 2021-22 homeless enumeration would not be possible without many resources from the federal, provincial, and county governments, from emergency shelters, transitional housing, motel voucher service providers, housing resource centers, outreach teams, VAWs, corrections, hospitals, enumeration planning groups, and people with lived experience. PIT will be carried out in the 5 SCADA regions. Surveys will be conducted by staff and outreach workers at social service agencies, healthcare providers, and correctional facilities. Street teams will count the outdoor locations where they have been assessed through a pre-count process that people experiencing homelessness are likely to be. Encampments that have been previously identified will only be surveyed by experienced outreach workers and, if COVID protocols allow, to protect the integrity of their space and the safety of the workers. Additional surveys locations could include all emergency shelters, domestic violence shelters, and transitional housing programs, street surveys to reach people living in public and outdoor spaces, service counts likely conducted over the phone by response directed to the survey through advertisements in local locations such as libraries and recreation centers and nonprofit service providers. Data from agencies and government, including those residing in institutions such as hospital, holding cells, detox centers. Because of the ever-changing requirements around the pandemic, we want to make sure that people take COVID-19 into consideration. We want to make sure that you understand all safety protocols recommended by public health in your organization, that we don't create magnet events where we gather large peoples together. This year, we are not using volunteers. Instead, surveys will be conducted by staff at community agencies. We will try to encourage as many online surveys as possible, but we'll have paper surveys available. Verbal rather than written consent when possible. We will not be using volunteers for data entry. We will be doing virtual training, and there will be no headquarter locations. How can you participate? There will be a flyer that can be put up, community boards, as well as social media posts that can be shared. The more people aware of enumeration, the more people we will be able to engage and to fill out the survey. Besides spreading the word, there are other roles which it will include direct support agency participation, non-direct support agency participation, and outreach teams in all regions of Simcoe County. Key agencies will administer surveys in their location. Area leads will work with agencies to identify locations outside the agency to maximize participation. In addition, outreach workers will be determining the location hotspots, such as parks and motels, where people can be found to complete the survey. What to expect. Area leads will be a contact person in each area, as well as giving direction to agencies and outreach teams. Staff from each agency will be conducting surveys who must go through a virtual training such as this. There will be a live Q&A session, one on January 21st and one on January 24th. We need everyone to sign relevant forms and receive their survey kits. And there will be a briefing email sent to all surveying participants. Please reach out to the following area leads by phone or email if you have any questions that are not covered in this training, or if questions come up while enumeration. We want to make sure that you and the people being surveyed are safe. Please follow all safety protocols as outlined by the health unit. Always remember to cough in your sleeve, keep appropriate physical distancing, sanitize your hands often, avoid shaking hands, and stop working and self-isolate and go to a public health facility if you feel ill. During survey taking, make sure you wear a mask, clean your hands with hand sanitizer, stand 2 meters apart, avoid shaking hands, limit the duration of your contact, and leave behind contact information.